Hello, I'm Richard Leong. You know, today we have a lot of problems worldwide because of the pandemic of COVID-19 or coronavirus. What are we doing in the dental office to prevent cross-contamination between one patient and another? That's a very important thing because in the dental office we have so many more hazards that we have to think about. So let's talk about how coronavirus is transferred from one person to the other. It's transferred through aerosols, or tiny little drops that come out of a patient's mouth or nose when they're breathing or when they're talking. But then if someone has the actual virus infection, then what they do is they cough or they sneeze. And the problem is that when they cough or sneeze, then those aerosols, those tiny little droplets, go about 30 feet in the air. And if they're just breathing, or if they're just talking, then it goes about 3 to 6 feet. So that's why when we're going to the grocery store, when we're going out, that's why the officials say you should wear a mask. So what are we doing in our office now to limit these problems or prevent these problems? The American Dental Association, the Centers for Disease Control, the Office of Health and Safety Administration, OSHA, has given us some guidelines about what to do. So let's talk about what we're going to do when you first come into the office. So when you first come into the parking lot, then what we want you to do is call us. And then we're going to go out and meet you in the parking lot. And we're going to take your temperature because we want to make sure that everybody that comes in the office, whether it's a patient or whether it's the staff or whether it's a delivery person, we make sure that they do not have any of the symptoms. And so that's universal. We want to take the temperature on your forehead. We want you to answer some questions about have you traveled any place, have you flown any place, you've been on a cruise ship, do you have any of these symptoms like the coughing or the low fever or sore throat. These are the things we want to know about because we want to screen people so that if you're sick or if you have a problem, then you want to go to the doctor. But we want to make sure that at least from a visual point of view and from a person's own standpoint that they don't have any of these problems. Then once we determine that you're okay from a visual and symptomatic point of view, then we're going to bring you right into the office. So once you get in the office, then we want you to wash your hands. We'll have a hand wash station, and then we'll lead you to the operatory. Let's talk about social distancing because we have to have social distancing when we're in this office. So if you notice, we separated the chairs at least more than 6 feet around our waiting room. We don't want to have more than 3 people in the office at one time. We have to slow down the schedule. So if you're out in the parking lot, you're going to be led right into a room, but then you're going to wash your hands. But if anybody's with you, like a caretaker or a spouse, or kids, if you're a parent and you're going to have your kids come in with you, then of course you have to be there. Or if your kids have to wait with you while you're in the room, then they'll have to stay out here. But we want everybody that comes into this office to be screened for temperature, but also they have to wash their hands. So we have a hand washing station over here that will have a hand sanitizer, and they have a trash basket so that you can take paper towels and put it in the trash basket. Okay, what's different about each operatory when you're in this chair? So when you look around the room, you're going to see that a lot of things are wrapped now, a clear plastic wrap. We've been doing this for a long time because, maybe about 10 years or so, because we do so many surgeries here. But the clear plastic wraps are meant to cover all the counters, everything that's within the distance of where the coronavirus would spread. Remember that even if you're not sick or have any symptoms, you're going to have this aerosol droplets in your mouth and coming out of your mouth for at least 3 to 6 feet. And so in this room, when we're looking around it, we see all of these wrappings here. That's because we're covering all the countertops, everything that could be covered with these aerosols that could have your virus in it. Remember that there are about 25% of the people that don't even have any symptoms when they have this virus. So we have to treat everybody like they have the virus, just like we've treated everybody if they had AIDS or if they had tuberculosis or the hepatitis. We have to treat everybody like they might have it. and so we're making sure that everything is covered. So you see that the chair is covered, the light's covered, all the countertops are covered. What we do before we cover them is spray them with a Lysol or a Clorox wipe so that the counters are killed of any virus or bacteria. Then we cover it, and then afterwards we take all the covers off, we spray it again. Each time we wash our hands before we clean everything. We wash our hands after we clean everything. There's a big regimen that we have to go through in order to make sure that this place is protected from passing one bacteria from one patient to another, or passing bacteria or viruses from a patient to the staff or staff to the patient. These are all things that we have to do. Now what we're going to talk about next is what we do that's over and above what the recommendations are for preventing coronavirus. This is called a three-way syringe. This is what blows air and water into your mouth. Now normally what most dentists would do would be to wipe this off with alcohol. Now that kills the coronavirus. It kills some of the bacteria, it doesn't kill everything. So we're just trying to be as good as we can, because if you put this in a sterilizer, it will ruin it normally. But what we do is go beyond that, because what we have now, or we've purchased instruments that are sterilizable. So we sterilize this, so it protects you even more than what the normal office would do. Of course it's very expensive, but we want to do it because we want to prevent this instrument from passing on bacteria or viruses to another person. So we do that. Now the normal thing that most offices do is sterilize this handpiece. Now that's been going on for a long time. Of course we still do that, but this is really important because this is the drill that goes in your mouth. Okay, now this is something that's very important, because we know that the aerosols are all around this room. We know that the aerosols are in a person's mouth, and so when we're doing a drilling, then the drilling goes, it's a tornado effect, because those drills have a 400,000 RPM, and so the whole tornado effect is going throughout the whole room, and all these aerosols cover this whole room. So how are we going to prevent these aerosols from passing from one person to another? One of the big things that we do now is have an air filtration unit in every room. Again, this is much more than most dentists have. Most dentists don't even have this. It's because it's too costly. But this air filtration unit takes all the air in the room and circulates it through the filtration system. It does that 5 times an hour. So when we prevent the aerosols from going into the air by other means, and we're going to talk about that, this is one of the means that we do to catch all the rest of the aerosols that are in the air that we haven't caught by other means. We have to have a filtration device on our mouth. This is a mask that covers our mouth so that we don't give you the aerosols we have, and we don't get the aerosols you have. We have a visor that prevents all these droplets and aerosols from getting into our eyes. We have eye protection, our glasses. We have a hair bonnet that prevents all the aerosols getting in our hair. We have our gloves. We have this protective outfit that we wear all the time, and we change for every patient that has aerosols. We're going to have booties on our feet to protect from bacteria on our shoes. This is what we have to do every time the patient comes in, and between when we put things on and we take them off. We have to wash our hands. Everything has to be done in a certain order. As I said before, the most important thing that we want to do in the dental office is to prevent cross-contamination between one person and the other. So that means cross-contamination from the patient that just was in this room to the person that's coming next. Also between the patient and the staff, the people that are working on you, but also vice versa. The staff, the dental staff, the dentist, and the patient. We could give you coronavirus if we had it. So we obviously want to wear all this PPE, the protective equipment, but also we want to make sure that we don't have it in the first place. So the most ideal thing would be to have you, the patient, be tested. Well, that's not practical, because we can't test everybody every day, and there's not enough tests in the world to do all that. So we just have to go by symptoms. But what we want to do as a staff is test ourselves, because we have more access to being tested. So we were just tested a few weeks ago, and we'll continue to be tested to make sure that we're not the cause of your having coronavirus in your family or yourself. Okay, let's talk about the most important way that we take away aerosols. This is our HVE, our high volume evacuation system, and known as a suction. And so 95% of all the aerosols that are going to be in your mouth are going to be taken out by these two lines here. So this is called an isolite. This goes in your mouth, and it will suction out. This high-speed suction will go, this goes over your throat and over your cheek and close off the back part of your mouth where all the saliva is coming out and where all the volume of the aerosols are coming out. So this is going to catch 50% of it, this is going to catch the other 50%. So we got it from both sides of your mouth. Suction here, and we're going to take away 95% of all the aerosols that are in your mouth. That's very important. And what happens to the rest of that? Well, the rest of that is going to be filtered out through the air purifier in the room that we just talked about. So this is a rubber dam. Now we may isolate one tooth or several teeth when we're working on the patient's mouth. This whole assembly goes over the patient's mouth. So then all the aerosols in the patient's mouth don't get into the environment because it's covered. And so the way we do that is we put this is for a root canal. We're going to put this one clamp over a tooth and clamp that down into the patient's tooth there. Like that. So all we see when we're working is just the one tooth. So then we can go ahead and do the root canal on this patient's mouth, or if we're going to isolate several teeth, like we're going to work on several teeth, we isolate several teeth there. But that prevents all of this moisture, all of this aerosols that may have coronavirus from getting into the air. Okay, now another very important way that we prevent cross-contamination from one patient to the other is not by not touching anything. So I have electric eyes on everything. So electric eye on the water here, so we don't have to touch any handles, so we don't touch a handle that we have touched before that we could pass on the bacteria or the virus from one person to another. This is an electric soap dispenser, so soap comes out so we don't have to touch anything like that. Here is the electric towel dispenser, so we don't have to touch anything that way, so that the virus or the bacteria is not passed on from one person to the other. And we have it not just in one side, but we have it also on the other side. So this is the side for the assistant. Okay, now you've heard from everybody that you're supposed to wash your hands a certain way, and you're supposed to wash it for 20 seconds. So we're supposed to wet our hands first, and then we're supposed to have some soap, and then we're supposed to keep on going, and we're supposed to wash our palms, then the top sides of our hands, like this, and in between the fingers, and we're supposed to wash underneath our fingernails, so we go like this to make sure that we get the fingernails underneath this. We don't want to have longer fingernails when all the dental assistants and all dentists have to cut off all their fingernails. We don't want anything caught underneath their fingernails. And then we want to do our thumbs like that. And make sure that all parts of our hands are covered for 20 seconds with this soap. And then we're going to rinse it off and then we're going to dry it. But that's the right way of doing it. This is what you should be doing at home. We just have to be careful and disciplined in order not to touch anything else, or if we do, it has to be covered. So if you look closely here, you'll see covers on the handles, so that we disinfect them first. We put alcohol on them, then we cover them here, so if we touched it, that we're not passing on bacteria or virus to you. We have a cover on the keyboard, so we're not touching anything there. Then we're going to take that off and put a new one on there, and we disinfect that. We don't want to touch our glasses. We don't want adjust anything. We don't want to adjust our PPE or the helmet or the hood or the visor. We just try to discipline ourselves not to touch anything, because we could have the bacteria or virus on our outside of our protective clothing, and then go ahead and pass it on to us or to you. Every time that somebody uses our bathroom, we go in there and we clean it. We disinfect it, we put spray on it, we clean all the handles, we clean everything, the toilets and the handles on the faucets, the handles on the toilet. This is something that, again, you don't think about, but we have to do. Okay, what I want to show you is the internal architecture of this building, because this building was made for closure in every room. Every room has doors to it, and this is very good for this type of problem with the coronavirus, because a lot of newer offices have an open environment where it looks light and airy, but the problem is that the coronavirus and all the aerosols will flow from all over the office and around through the back part of the office to the front part of the office. But in this environment, we want closure because we want privacy, and we want containment of the aerosols. In this video, what I wanted to show you is all of the things we do in this office that are conforming with the new guidelines that the ADA, the American Dental Association, and the Centers for Disease Control, the CDC, and OSHA want us to do, but we have gone way beyond that. We want to be able to prevent aerosols from contaminating from one person to the other, preventing aerosols from contaminating from the patient to the staff, and the staff to the patient. And because I'm of a risky environment too, I mean, we as dentists have so much more aerosols. And in my age group also, we're higher risk. So I'm doing it for you, but I'm doing it for me. I don't want any of this happening to me, and I don't want it happening to you. So all of the things I've described before are the things that we've done over, beyond, and above what all these guidelines want, because we all want to stay safe.